Hey. Thanks everybody for coming for the first quality improvement affinity group. We're getting back together again, and so we hope other people will join us over time. And we know some people wanted to come, and we'll listen to the recording. So we'll get started. It's Connie Davis. We're here from CCMI, and Kathy Rhymes is here to help me. And so what we're going to do is just get started. So I'm going to share my screen. So hang on while I get that ready. Okay, there we go. Okay. Great. And so the first thing we wanted to do is that Mariah's going to do the land acknowledgement.
We gather in this virtual space, we acknowledge and honor that the region NCACH serves is on the traditional lands of the Confederated Tribes of Colville Reservation, both past and present. The traditional territories of the tribes extend across north central and eastern Washington and into portions of British Columbia, Oregon, and Idaho. For this land acknowledgement with gratitude and appreciation for the land itself and as a commitment to amplifying Indigenous voices and recognizing the harm done to them as a people.
Thanks, Mariah. And the other thing I'd like to acknowledge while we're here is acknowledge all of my teachers. There are so many people that I've learned from over time, and especially in quality improvement. So folks from the group Associates for Process Improvement, most closely Lloyd Provost and Jerry Langley, and dear people there at that group. And so and another person the topic I'm going to speak to you today, I've learned a lot from Dr. Heather Gainforth, and she's done a lot of research around translating research into practice, and so that's what I brought today. So while you're here, I just wanted to let you know what the purpose is, we think, of the affinity group here. And it's to identify and learn methods and tools to carry out change and quality improvement, to support the development of a shared language, skill set, and approach, to facilitate local and cross-sector change and improvement efforts, to convene cross-sector partners in shared learning and dialogue related to relevant local quality improvement topics, to engage partners in taking leadership role as it relates to sharing, teaching, learning, and collaborating in change and improvement, and to model quality improvement and measurement for quality planning, quality control, and quality improvement. So lots of jargon terms there. And here's what we're going to do. We're going to just go around and share different folks what you're doing around quality improvement, if you've been testing things or just a recent observation or a lesson learned. Then I'm going to tell you a little bit about the human side of change. We'll have a couple of discussions in there, including an activity. And then we're going to do just a little closing and evaluation. So I'm going to turn this slides off here in a sec, but just what's been going on for folks. And we're a small but mighty group today, so I don't know. And I'm going to include Mariah and Kathy, everybody in this, because thinking about quality happens not only at work, but in our personal lives as well. So I don't know if somebody wants to volunteer to start, and then I'll just go around the room, or I'll just pick a place to start. So who has something to share that's activities they've been doing?
I can start. Oh, first, go ahead.
So we just spent the morning doing root cause analysis of our inbox because it's kind of a disaster.
So say that again.
We just did some root cause analysis of our inbox
Oh.
with our EHR, and it's all over the place with all the different things. So we just spent the morning we had like several different focus groups with people from different teams. Our operation team met with the navigator team, like the medical records team, and then we met with the providers and nurses, and like what's going on with MAs, like what's going on with your inbox, what are the things taking your time, finding out those things and assigning some initial action plans, and then also things that like, okay, we need a work group created for this because we don't know enough about this.
All right. So you did a root cause analysis. I'm just kind of curious, what method did you use? What kind of stuff?
So we got a Jamboard and used a fishbone diagram.
Nice. Nice. And did anything surprise people? What was on there?
I don't know if it was surprising to a lot of us as much as what was interesting is actually getting a report of like what does our EHR say, or who's doing what task and at what percentages, and the percentages were like lab results are killing us, like 5,000 lab results in the last month that we have to deal with. Like we've got to change something. Like I think getting that data of like what's actually there in the task box. It says 1,000 and some in there. What percentage of things, that was surprising to people.
Mm-hmm. Wow, that's interesting. Good. Thanks, Ton. Great.
Well,
Kathy, I
I
don't know if
can
you.
go. We are onboarding a new employee, and we have done that in quite a few years, actually, a couple of years. And so we are evaluating our communication systems and our workflows, which have devolved during the pandemic. And also, you know, once you get used to working with each other, you kind of get your own workarounds. So we are in the process of evaluating and trying to understand those communication pathways, just in the gathering setup phase of that.
Great. And welcome. We are doing a roundtable sharing of what kind of quality improvement activities people are involved in, everything from tests to whatever. So, who would like to go next?
So I'm Jessie with Rural Resources, and currently we are working on a grant management project. So I've started with the fishbone diagram, and I'm starting with one division. We have quite a few divisions here, so we're trying to pilot this for one area to see if we could then expand it for the entire agency. But it's basically, it started out me thinking this is going to be like an easy thing. We just give all the information, put it on a grant calendar, and move forward. But then we started with the process that you guys have worked with us on, and I started with a fishbone diagram and realized that this is going to be a much bigger project, or at least we're going to, in the end, it will eventually be a much larger project, because it came out that, you know, one thing that was really important to people was the process, like having an actual process in mind. How are people doing things? And it's then discovering what one person does versus another person, and which way do we want to go, or can we do that? You know, so there's a lot more discussions around some of these processes. And then on top of that, it's information. What information do you need to have within your grants, and how are you going to get that information in a quick, convenient way? So we've kind of started there, and we've started with a charter for it. And then our next piece is, you know, getting all the information collected, and then we'll start talking about some different testing methods that we can do, such as, are people using this? How often do you go in? And we're still working on that piece of coming up with testing methods. So it's very much a work in progress.
Great.
Thank you.
Thank you, Jessie. It's great to just hear you use all this language and all the things we've been talking about lately. So that's awesome.
I know, I love all this stuff, so thank you so much.
That's great. That's great. And Katie and Michelle, I'm hoping you can share with us a little bit about things that are going on, what kind of QI tests or lessons you're learning. So, Michelle, looks like you're off mute. Oh, that was maybe accidental. How about you, Katie?
Hello. So I am kind of sort of doing QA projects right now. A lot of what I've been doing right now is kind of working on our community health assessment. And so I've been using some of the ideas from QI to kind of make sure that the work we're doing is good work, right? So we had a community survey tool, and it was essentially a conglomeration of about 4 other tools that have been used by other folks. And I took it and was like, okay, this is an idea. What are our thoughts? And kind of, I have advisory boards throughout the county that have been providing feedback about the language isn't great, or there's too many questions, or the formatting is ugly, whatever it may be, right? Like, but we just want to really like try and make sure we're getting good quality data from people, and that the survey is useful, rather than building a survey that nobody takes, or they take it and then the data we have is terrible because it wasn't written well and everybody had different ideas. So we're kind of in like a piloting PDSA cycle. I sent it out to each of the advisory boards and was like, can you please try and break my survey? Like,
Yes.
use this link, break the survey. do it. So I've been using some of the principles. I
Great.
really haven't had a lot of time to do actual QI projects. As of Friday, that's the first, we will officially be using our new and improved tracking tool and referral system for our SSP folks. So super stoked about that. And then later in July, we'll be giving a presentation during our all staff meeting to kind of tell the rest of the organization, like, hey, this is the QI project we did. This is how it went. This is what our end goal was, right? Like the outcome of it. And I think that's where we'll get a lot more feedback on, okay, these are other QI projects that could potentially happen throughout the building. But yeah, we're really in like a real transition phase right about now. It's new grant cycles for most of our programs. So everybody's just like really busy and it's chaos here right now.
Yeah, sounds normal. Thanks, Katie. Well, it's busy at the health department for sure. That's awesome. And so, some of you, Ton, just for your information, we just finished a QI sprint with several community organizations. So some new faces for Ton. Ton's somebody that we know back from the years past. So, and also Dwayne, who's just joined us. So we're doing a roundtable right now. And Michelle, your mic's working, I think. Michelle, we can't hear you. Michelle, I'm not hearing you. Oh, phooey. Looks like Michelle might be having some technical difficulties. All right. So Dwayne, I don't know if if you've just popped right in, but people have just been kind of sharing what's going on. So if you want to share a little bit about what's happening, that would be awesome.
Sorry it's late. We're actually in another meeting, and part of it was talking about quality improvement and how we can, we're looking at our patient count, looking at retention. And so we just started having our conversations. We've been having conversations around, what we were doing already, but now we're actually involving more people. So it's not just the director, myself, and the financial person. We're now getting the clinical manager, the program manager for our English program, Spanish program, our which all management. So we're now starting this. We're having meetings every Monday. That's going to be addressing how we can improve our processes, how we can improve client retention, how can we improve getting clients in the door in a more efficient manner. Just basically kind of looking at the whole thing. So this is a big project that just started for us today. So
Awesome.
that's really what I have to share currently that we got going on.
In big change mode. So Dwayne's from the Center for forget if it's alcohol first or drug first, Dwayne.
It's Center for Alcohol and Drug Treatment.
ADT. Oh, okay, great, good, excellent. Thanks, everybody. And I don't know, Mariah, if you have the ability to come off mute and fill us in on any quality improvement activities that might be happening in your neck of the woods.
Yeah, we actually are launching a task force, a learning task force with some community partners of ours and 2 NCACH staff members to kind of dig in and see what we can do to improve our approach to our monthly convening meetings that we're doing. And so the first meeting for that will be on July 25th. So hopefully at our next meeting for QI Affinity Group meeting, I can fill you in on the approaches that we're using for that. But we've built the task force and we're creating the objectives and convening structure and kind of all of that right now. So
great. It's also a project with a good measurement strategy almost built in. That's good. And unfortunately, Michelle, we haven't been able to get Michelle's audio yet. So Michelle, if you want to chat in, that would be, ideal too. So we'd welcome that. So what we decided to do when we relaunched the QI Affinity Group was to do this, have roundtable sharing, so everybody can kind of touch base and hear what's happening, because there might be something that you could do together or some support you could offer. And then, have either one of you present something about what's going on. Like maybe we can see Katie's presentation about her project after she's done, if she's willing to do that. And then, so have a little bit of, content and some activity for sharing, and then plan for the next month. So, and this topic this month actually was prompted by Jessie. And so I hope everybody will find it interesting. So anything else to say before I do just a little bit and share some information with you? Okay, I'm looking at faces. Okay. I'm going to share my screen again. So here we go. All right. So one of the things that is, a topic that, we all could probably talk about forever is the human side of change. Because whenever we're making these improvements or talking about asking somebody to do something different, even a test, in their role, we're dealing with human beings. And so one of the ways that I like to think about human beings is with an analogy, which is about the elephant, the rider, and the path. And so I'll explain that to you in just a minute. But this really was prompted by a comment about, what do I do about pushback? So you've got this quality improvement project, you've got some great ideas, and people are saying, oh no, I don't want to do that, I don't have time, or whatever. It's just they're resisting the change that's been introduced. So today, what I hope to do is to show you a way to think about the factors that influence people's interest in change and to help you consider some options to support people to consider change. But it actually starts with a story. Because there's a lot of theories about why human beings do the things they do, and you can talk about it in a lot of different ways. And one of the ways that makes the most sense to me comes from Dr. Jonathan Haidt, and he's at the University of Virginia. He's a psychologist, and he uses a story to help us understand the tension between, why we feel different ways about making change. And so he says it's like thinking about an elephant that has a rider on them. And I'm going to add a little bit to Dr. Haight's story and adding in that the elephant is on a path. Now, this is a picture of a friend of mine, Georgina. She's in the red shirt in the back there, riding on an elephant on a trip she took to India. And you can see there's the gentleman in the front of her who's the directing or trying to direct the elephant. And so what Dr. Haidt says is that, all of us have two minds about things. We want to change and we don't want to change. And if you with that ambivalence, feeling two ways about change is really normal. And he says that we can think about it, that there's an elephant, and the elephant really represents our emotional side, and the rider's kind of our rational side. And so when the rider's perched on top of the elephant, the rider's kind of, holding on, and usually they use, they have some kind of rein-like things they use to direct the elephant. But the rider seems to be in charge, but the rider's control is really precarious because the rider's so small in compared to the elephant. So anytime that big elephant decides that he wants to go a different way than the rider, will lose because the elephant is so big. He's completely overmatched. And so you might identify with this thinking about your own experience of having a second piece of cake when you really don't want to, increase your sugar intake and you're trying to eat healthy, or when you're trying to decide, should I go exercising tomorrow when the weather's just super hot? I mean, we feel two ways about something. Our emotions are telling us one thing and our rational mind is telling us another thing. It's also the same thing kind of happens when you're in a crowd or when the environment kind of encourages you to do one thing or the other. So that's why the path is important. If you look at this particular picture of the elephant and the rider, there's like a walled path there. So that elephant really only has a couple of choices. The elephant can, well, maybe three. The elephant can go forward, the elephant can stand still, or the elephant can go backwards. But it's in this walled, street. So the elephant has a limited range there. And so we can actually use this model to understand how people kind of work around change. So what we're going to do is talk about the elephant, the rider, and the path, and kind of put those into perspective to help us think about what's going on when people aren't interested in change and what might we do about it. So one of the things to do is to really think about them all separately. All right. So the elephant represents a couple of things that influence behavior. And so the elephant represents strength, and these two things have a pretty strong influence on change. So that's the physical ability of the elephant and the emotions. Okay. And so if you think about a human being, we need to have the physical capacity to do whatever it is the change we've been asked to do. And for most of us in quality improvement, we don't have to think about physical capability very much, but in some changes you might be trying to support, you might have to think about people's physical ability. What we do need to think about is the emotional component of change. And so this has to do with our what we care about, and it can be kind of an automatic sort of a thing that happens. We might not even think about it. So our desires, our habits, and our feelings are all part of this elephant. So let's look at the rider, and then we're going to talk about them all together. So the rider also has two things that they represent. And so the rider has brain potential. So this is psychological capability. So when you're asking somebody to do something, do they have the mental capacity to actually do the thing you're asking them to do? All right. So they need to have knowledge, and they need to have thinking ability to work through things. The other thing that's just kind of part of that, but maybe a little bit different, is the ability to reason. So some people call that deliberate motivation. So they need to be able to take the different alternatives and weigh factors and decide what they want to do. So that's that rational mind. That's the rider. And then the last factor is that path. And so the path is the environment. So the actual shape and characteristics of the environment that people are in. And so that can be thought of as the physical environment, the opportunity in the physical environment. And there's also something else that's really important in the path, and that's social opportunity. So that's the influence of others. If there are people standing along this journey, cheering you on, saying, yeah, go, that's really helpful. Or maybe they're standing around saying, oh, this idea sucks, we don't need to go there. Then those are kind of issues that can really create barriers in the path, so that people don't want to change. Right? So that's our elephant, our rider, and the path. Right? So before we talk about these in detail, just think about the elephant. The elephant's really strong. They have amazing strength, but they have frustrating faults. The rider has these amazing brain power and also weaknesses. So the weakness in the elephant is where sometimes our instincts and our emotions take over, and it makes us skittish. Sometimes our change efforts fail because of that. Elephants want instant gratification, and that's the opposite of the rider's strength, which is thinking about the future and planning ahead. And so sometimes the rider can't keep the elephant on the road long enough to reach the destination. But the elephant's great strength is those emotions. Elephants care about what's right. They care about things. The elephant represents compassion. That's why most people get into the kind of fields that they do, is because they have that strong emotional drive. The elephant can get things done. So we need both the elephant, that drive of the elephant, and we need the brain power of the rider. So what I'd like you to do now is to think about, in the change efforts you're making, what's going on with these different parts of the picture. If you think about a change where you're getting pushback, what's going on? So what I'm going to do is stop sharing, and I'm going to drop a little handout in the box for you here. So hang on while I look at my other screen and try this out. So I just said a whole bunch of words. And oh, it's not letting me drop that in there. I don't know if that's a setting that you can change while we're here, or we'll find another way to do it. Phooey. Usually I can drop a PDF in, but I can't do that right now, so I'll show you. We can do it this way, and then I'll send it to you after the fact.
Connie, is it the document that you sent me yesterday?
It is.
Okay, I'll try to do it from my end.
Okay, see if you can do it, and I'll also share it here on the screen. I can do that. Okay, I'm going to share this here. And so we're a small group, so let's just have a bit of a discussion. I know some of you need to eat lunch. But thinking about the elephant, what do you think might be going on with some of your change efforts around the elephant? Are there any physical ability issues? Are there emotions and habits that might be impacting people's willingness to change? So I don't know. Katie, what are you thinking?
So organizationally, we kind of have two maybe three groups of people, really. Like we have the people who've been here forever and everything has always been paper and pencil, and that is just their jam, right? Like they hate technology, they don't want to use it. And then we have the people who are like, we've always done things with paper and pencil, but also like I'm not opposed to doing things without that. And then we have a pretty large group of us that are like, I swear, if you give me one more piece of paper that I have to do something with, I'm going to scream. Um, so, I mean, yeah, like we definitely have kind of three different elephants, and some of them don't want to do anything, and some of them are like, yeah, please don't make me write anything else on paper.
Yeah. Thanks for that example. I see Ton nodding her head there.
Oh, this whole like our IT team wants us to go completely paperless. I am completely for it, but I have some people that will die before we take away paper. They're going to still print their documents no matter what. So I hear you. um, but I was just wondering, for that elephant, is this like the human nature part of? So one thing we discussed this morning during work group is you kind of cherry pick your task. If you have a bunch of tasks, you're going to cherry pick the ones that aren't difficult, right?
Yeah.
And then that leaves the bag for someone else to get the more difficult ones.
Yeah. So I think, yeah, I think I would put that into the elephant because that's kind of an emotional, kind of a desire sort of a thing. It's like I really identify with this, so you want to do that. Yeah. 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 Other people's thoughts about the elephant, things you're seeing in your world. Dwayne.
So kind of way I look at this elephant though too is I also look at the staff. You have staff who are actively engaged in your business and they're willing to do the things, get the training and all those things. And then you have staff that are just there for the paycheck. They're more disengaged. They're not one way or the other. And then you have some staff that are actively disengaged. They're the ones that are like, oh, this is stupid. They're kind of talking behind the business back. So I look at kind of like this elephant. You have to look at your staff that you have available. So why would I look at some change and work with staff that are actively disengaged in our agency? Because you know it's going to fail immediately. So you're setting yourself up. You're setting the agency up for failure. I'd rather look for those people that have been there, rather either been there for a long time or even a short time, but they buy into what the business does. That's the people you really want to wrap around, and that's the ones that can make you succeed when it comes to quality improvement. So just kind of my take on that elephant is, it really comes down to your staff. I think that and also who's presenting it. If you have a person that comes in that's presenting your quality improvement and they're kind of wavering in their voice and stuff, that's another elephant. Or do you have somebody who comes in that's just too overbearing about it? Like, you're gonna do this. People would naturally be like, oh, no, I'm not. So that's kind of what my take is on it, is you got to find that happy medium and then approach the right staff that you want, that can make this succeed. And maybe from there, your people who are kind of disengaged, they'll go along with it because it doesn't impact them so much by the time it gets to them. So just my little take.
Thanks, Dwayne. And Jesse, what are you thinking?
Well, I was just going to mention with us, I think that it really comes down to habit. Like we are in such a comfortable zone of doing things the way we've always done it. And then on top of that, the time that it takes to change something. So you have something that is working, could the system work better, perhaps, but you have something that's working now and you have very little time to change it. Yeah. And that's, I think, the biggest hurdle that we have.
Yeah. And time actually gets put into the environment. Because that's kind of and that's great, because that's exactly where we're headed, because they all interact, right? You have all three of them, because the time is a constraint of a resource, right?
Yes.
Yeah.
Yes.
Yeah. Yeah. Other people have comments about the rider or the path. If you think about, are there issues? Because this is what, there's a scientist, Dr. Susan Mickey, and she has other, fancy science words for this, but it's basically the elephant rider in the path. And she calls this making a behavioral diagnosis. So you look at the situation, you're kind of diagnosing, where's the issue lying? Because it turns out there's research that actually will help you decide what tests to try, what interventions to try, based on where you think the issue is. So a lot of you are saying habit, or emotion is an issue. And Jesse's been acknowledging time is an issue. How about the writer? Do you think there's, like thinking ability? Probably not in your staff, but maybe reasoning ability that's going into it? Are people not thinking about it?
I think if there's multiple writers that don't agree, so you have different ideas, different opinions, and even though they might all be great, it's like there's an issue, they know the issue's there, they want to change, but can't agree on the change, and so the action never happens. So
Okay.
lots of great writers. But
Great. And Katie, what were you going to say?
I don't know which bucket this goes into because it's like, so a lot of the things, like I'm again all for like modernization of all of the things. Like I want to modernize all of our systems, like no more paper ever again. And so a lot of people are like, well, that's going to take us a really long time to, switch over to a new system and things like that. But it's like the amount of time that you are going to save in the first week to month of using this system is going to make up for the amount of time you had to put in to get it implemented, right? Like if we stopped doing all these things, nobody has to make copies anymore. Nobody has to go and find the copies. It's all like available on this digital platform. Nobody has to hand calculate things. Nobody has to sit there and enter them manually into the spreadsheet, right? Like it all just automatically goes there. There's no more like, and that's one of the things that I did with our CERN service program before we even did the QI project. I was like, I am not doing this on paper anymore. Like we had because during COVID, like everybody went to work on COVID stuff, right? So nobody was entering any of the paper forms. So I want to say like 8 months worth of documentation that I had to enter to be able to report. And then they were like, oh, by the way, you need to report all of this to Department of Health, and you need to make a presentation for our Board of Health, and we want a formal evaluation report. I was like, okay, you do realize that it's going to take me like 3 weeks of just doing this to get all this paperwork entered, right? And that was my breaking point. I was like, we don't have staff time for that. Like, I'm never doing that again. I'm fixing this. But I don't know kind of like what that goes into, right? Because like some people don't weigh those factors, right? Like
That's where I would put it. I would put it in reasoning. It's about thinking about the factors, and are people really, thinking about all the different factors. And there's probably some social influence happening too. I think that's the under-recognized issue in change efforts that are really having challenges, is the influence of others in the community. Like Dwayne was saying, the people who are talking, and that sort of thing. Yeah. Awesome. So this is one thing to think about when you're, feel pushback is, really thinking about it. And one of the best ways to do it is to talk to people. Ask them what's going on. We've been talking about this. Tell me what you're thinking about it, and see so you get an accurate diagnosis. So let's look a little bit about. When I see there's a chat, let me see what this is here. Great. Okay. Thanks for getting that in there, Marat. So the next thing to do is to think about, once you kind of have a behavioral diagnosis, is matching up what you want to try to the diagnosis. And that's where Dr. Mickey and her colleagues, they've actually done an analysis of all the literature in supporting behavior change. And there's ways you can match things up. So let me just show you a little bit about their ideas about what works best. And so hang on, I got to get my stuff a little organized here a little bit. Okay, so here we go. This back to the slides. Alrighty. So once you understand what's going on for the writer and the elephant and study the path, you have your behavioral diagnosis. And the fancy name for the model is called the COMBI model. And if you want links to the literature, I'm happy to send that to you. And so you end up with an analysis. So we just talked about, in our group about where do you think are the things that are going on. So then you look at that, and what you're going to do is you're going to think about, how can I motivate the elephant? How can I appeal to people around their emotions to overcome their habits? How can I direct the writer? What can I do about that rational thinking and that physical part? Or how can I shape the path So make it easy for people to do the right things. Okay? So when you look at those things, here are some things that work to motivate the elephant. So if it's physical ability, you can train or you can enable. None of us have physical ability issues right now. Enable means when you actually give something to somebody to make it easier for them to do it. But so that's not our issue. Emotions and habits. So you can try persuasion, but you need to be careful with that one, because like Dwayne was saying, when you push people, what do? They push back. So that doesn't always work. You can provide incentives. Incentives are good to get people to try things the first time. They often don't help behavior persist, but you can make a game out of, doing something like using the electronic record the first time, give a door prize for everybody who uses it this many times, they get an entry. You can try things like that to incentivize. Coercion or force works, but those are not recommended. But they are, you have to acknowledge that those are ways you can actually force people to change habits. You can try training, to train people to do things, because sometimes it's confidence that keeps people from doing something new, especially like with technology. And I think somebody said it, that people don't like technology. A lot of people have a story about technology, or I'm not good at technology. And so helping people overcome that. You can also change the environment sometimes. That'll work. Hard to take paper away in that case. Although sometimes that works. You can take away the old way. You can model it. So have lots of examples of people doing it, walking through it, showing them how to do it, especially if it's somebody they really respect. If they see somebody they respect doing the behavior you want them to do, that can be really powerful. Or you can enable, you can actually give them something. This is going to be probably an example that won't fit for anybody, but maybe people who are used to using paper would go for a tablet, something that they could carry around, that they could easily take notes. Or maybe they would go to something they could dictate and use drag and dictate. So that's an example of enabling. So those are things that match those particular issues. If you're looking at the rider and directing the rider, if it's a thinking ability problem, which we didn't think we had, but you can educate, you can train, or you can enable. Those are three things that work there. If it's reasoning, education can help. Where like giving people that data that you were talking about, it's like, if you actually had some data saying, this is how much time and other groups have saved by trying this new approach, that can help. Again, you could persuade, but be careful. Incentives might work. And of course, there's coercion or force. We don't recommend those things either. So those are things you can try. And then there's shaping the path. So sometimes you can use training. You can restrict what people can do, like make it impossible to do something without entering the data. You can change the environment so that everybody has access to the technology. I'm going to keep using that example. That would be one way to do it. Or again, enable, give them new equipment, something that makes it easy for people. The social context, which again, we forget the social context. In some cases, you can restrict things so that people can't do something in a way, change the environment. Again, modeling is really powerful. And so when you start to see one of these ideas come up multiple times where you think there might be an issue, that's one to go for. So like modeling might be a really powerful one. Or again, you could use enable, use equipment or try equipment. So what I'd really love to hear from you all are thinking about which one of these ideas kind of says, that might be worth trying in the problem that we're having. Modeling, changing the environment, what might work with the things you're facing?
I'm biased towards
Very
changing.
good.
Yeah, sorry. I like, especially when we're talking about EHR, the more we can change the environment to make it less clicks, more like more regular typical things that are just really routine, the better off it is for people behavior. But I also, that mentoring part, I'm learning that this is a different project, but like getting content to staff is one thing, but having staff use that content with patients is a whole nother skill set. And it has to be that mentoring, see when, do when, and have someone hold your hand as you do it. Is really important.
Yeah, so I hear like some like modeling also and like training, but right by your side, kind of, yeah. Yeah, thanks for that. And Jessie, I think you were going to jump in there too.
Yeah, so the thing that I'm trying is I put it out as a pilot. So we are piloting this um, for something that's going to benefit you, and I want your input on this so that we can make it something useful for you. Um, and with the thought in mind was that I get opinions and um, the input from others, and because they're the ones saying it, is that it will happen. And then with doing this trial or pilot, we could then expand if it to like a proven model and expand upon it. So that's kind of the approach that I've taken, which I see that it fits in with these little pieces as well that you mentioned.
Yeah.
So
Yeah, no, that fits in really well because I think you're appealing to people's rational mind, in addition to some of the other things. Yeah,
hope.
yeah, yeah, yeah.
The other
Dwayne,
thing is, I kind of like the enable part is you enable the staff to definitely help out with some of the quality improvement stuff because that's again the buy-in part of it. And when they hear that they they're having some input in here and say me even just a piece of that input gets applied to the project and giving them the recognition that, hey, by the way, we have this new project and here's the following staff that have helped formulate this. Giving them that recognition in front of their peers is a kind of a big thing as well. But then the next time you have the next quality improvement project, knowing that, oh wow, you know what, so and so they got some input. Now I'm being asked. There's value there to the person. Like, hey, I may have a permanent impact upon this business. So and then after that, you may not even have a cute quality improvement project going. You may have staff coming to you. Hey, you know what? I think we might have a way to make this better. I recently got to experience that. Is we're trying to figure out how to get our evals here, and I've been working with our front office staff. Is enabling them to bring things to me that I may not be seeing, and let their voice be heard. And so they came to me and said, Dwayne, you know what? Our client engagement module is not working incredible. We want to go back to calling them a day before. So either A, we can confirm the appointment, or we can get another person to fill that slot because our counselor's time is valuable. So by doing that in some of these other bigger projects, you may have the small stuff that comes to you that, oh, that's quality improvement right there. We want to reach out to the patient, and it's beneficial for our business. So enabling them in that sense is something that I think is really huge that can help you down the road. And it also, they now have becoming an actively engaged employee at your agency.
well, I hear a lot of social context in what Dwayne's saying, right? You're kind of building this kind of atmosphere where this is kind of what we do, and this is we cheer people on. We're open and willing to change, and we kind of like that kind of thought. I don't know, Katie, if you had any thoughts about things that might be worth trying in your environment.
Um, I think it's partially just like trying to get all of our leadership team on board, or maybe not even the leadership team, but like the people who've been here for a while, right? Because the people who've been here for a while have a lot of influence on what and how we do things. And so I think a lot of us newer folks have a lot of really great ideas. And I mean, a lot of us come from a lot of different backgrounds versus our leadership folks. And the people who've been here for a long time, like they've been in public health their whole lives. They've worked for the health district for 20, 25 years, right? Versus a lot of us that are new here, like we come from healthcare, we come from other community-based organizations, education. So like we have all these new different experiences and we're like, listen, there's a lot we can do. It's just trying to get people to actually listen to us and be like, okay, I promise this is not as painful as it sounds. Like we'll get through it together.
Yeah, yeah. There's some comments there. Thanks. Dwayne would want to leverage all that great background, right? And I think that's what more and more people have been talking about. It's the cross sections. It's where we all have different ideas that makes for richness. Kathy, I don't know if you'd like to speak a little bit to what you were talking about there in the chat.
Well, we were talking about the social influence of the path, and boy, I've really found that to be true. And sometimes as a quality improvement leader, people get perhaps a little tired of hearing you, or there she goes again kind of thing. And so finding someone else that is thinking along the same lines, whose opinion is valued, is a really, it's an indirect way to shape the path, but it's really powerful. So finding an ally. So for Katie, somebody who's not totally anti-technology, but doesn't really want to move down the same path, but maybe they do this one thing, and that would bring other people along in one area. And that helps open the door for that next step. And it also allows people that may have an institutional knowledge, that have been around and have some really valuable knowledge, be able to help people see how the new idea fits with the knowledge and the direction of the organization. And it helps people not immediately resist the impact that, oh, it's a change. Well, maybe it's a tweak, or maybe it's a reframe, or if I look at it through these eyes, maybe you can see it differently. So those types of social kinds of shaping a path will come into play as you're working through this.
Yeah, the kind of and thinking, yeah, this and this are, yeah, experience. Yeah, and Ton, I see also you've talked about that too. So I don't know if you want to share a little bit more about the institutional knowledge and what you shared there.
Yes, it's just the employees have been here for 20 years. They know where things are. They know how relationships work. But if you're trying to make a change, that can be really hard sometimes because we've always done it that way.
Yeah.
And there's also a lot of mistrust because of previous change that may not have gone well.
Yes. Which is such a great reminder to for testing, in my view, right? Because if we test small, then you fail small and it's not such a big deal. And then one of my favorite things to do is to get the people who are not very interested in the change to be part of the measurement team, because then they'll be collecting the data. And then if the data shows that the change is working, it's really hard for them to not come on board because they were the one that was in charge with collecting the data. So seeing how you can involve people can be really helpful. So that's kind of like working a little bit on the psychology there of people being involved in the change. Okay.
I think the other thing is how you present the quality improvement change. You have some people that are visual learners, some people that can just hear it. They don't care about the visual. Understanding who you're presenting to and making sure you're hitting all of it without, because that's what I've learned. I mean, I've been at the center for close to 30 years, and I've had to grow as a leader to understand the staff that I'm working with or the other staff I'm trying to present to. I've got a lot of younger staff that they like the visual. Older leaders that have been around for a while, they know what I'm talking about. They get it, they understand it, and you can just talk to them, and you don't necessarily need that visual. And then you also have to deal with, you have people that are high tech, they understand the things. You have people who are low tech. So understanding who your audience is really huge when you go to present this stuff. Because again, if I'm a visual person, you're telling me I can't picture it in my head, and so I'm automatically going to be resistant. Those are some things I've had to really learn, and so which means it's actually learning your staff, learning the people around you, the age differences, the different eras they come from. Just really, if you learn your staff, that can help change a lot of things on your approach. That what's needs satisfying to them, because ultimately that becomes needs satisfying to the agency.
Well, the other way too that I heard you know your staff is know what their goals are for being there, because you can appeal to the emotions of folks. And so, Ton, we're going to give you a link to a survey. So if you could help us shape next month, that would be great. So if we could get that dropped in there. Thanks, Kathy and Mariah, are on that. So thank you so much, everybody, for really participating in the discussion. And so what I wanted to do was just to think about next month for a few minutes as we just wrap up thinking about the elephant, the rider, and the path. And so what I was brought for you today was really to talk to you a little bit about how you can think about all of these three things together, really understanding what's going on in the environment and thinking about how you might be able to shape things for change. So that's what I brought. And so if you could fill out that evaluation, that really helps us, and that'll give us ideas for next month. But if anybody knows right now something you want to make sure we talk about, let's just spend our last few minutes doing that. So in this next month, if you want to consider ways you can use what I've shared today, and then we'll think about what's good for next month. Tina will be coordinating the presentation next month. So people have thoughts about what they want to cover, or you can also put that in a survey. Looks like folks are working on the survey. Yeah. It's great to see you all. It's so good to be back. Great to see you, Dwayne, and it was great to see Ton and our new friends, Jesse and Katie and Michelle. So,
Yeah,
great.
thank you so much for doing this.
Okay. Hope it
I'll
was
think of
helpful.
some ideas for.
I
Great.
definitely like the
Thanks,
round
Robert.
robin approach that gives everyone an opportunity to kind of speak up if they want to and stuff. And it's not just here it is for 45 minutes and then you get, I definitely like that.
Yeah. Well, you all have so much to teach each other, right? All teach, all learn. Yeah. Great. Excellent. Well, feel free to drop off and carry on with your day, and it was lovely to see you.
Have a great day, everybody.
Okay.
You too.
Take care. Bye-bye.